when we are very, very angry. Because personally, this is one situation which makes me very angry. And I tell them point blank, there are women dying out there because they do not have access to a simple speculum examination, leave alone a VIA, a Willi, or a pap smear. They do not have access, they do not have the financial ability to come forward for one. So here you have paid for the preventive health check, and this is part of it. So really it is your duty, your responsibility to have it. And I find it makes a big difference. Quite many agree soon after this. Another major sector is offering the preventive health check to our own employees. And here again, just last year, one of our OT staff were actually diagnosed to have CIN3. And of course, she was very worried it could be an invasive cancer, but this was purely because of the preventive health check offered to our employees. And ultimately, the pathology report was normal, but this is one situation where we picked it up. So although it's a very young population, we are coming up with screen positives. Another way of attracting people we have found is the discount that is given on things like the International Women's Day or the International Mother's Day. Mammograms are perceived as expensive and painful. So the painful part, yes, we can counsel them, take a few extra minutes and they will be convinced. But the financial part of it, they are very, very reluctant. And as with any discount, we're going to buy a sari, we're happy to go into a store which is displaying a discount. Mammograms at a discounted rate, we have a very good number of takers who come in at that time. And I'm happy that such discounts are offered because it's an incentive for people to come forward. People who see us earlier, say from about December onwards, will actually say, can I come back in March for my mammogram alone? And which is a very welcome move. And I'm also happy to say that we actually at Apollo Cancers offered free mammograms for the marathon runners. And these were marathon runners for the cancer awareness program. So the cancer burden, as we can see, is definitely increasing. Now, sitting in a corporate setup, we cannot say we are blind to the rural statistics at all. We also have to be aware of this. So there is an increase. And now this, recently there's been information coming in on the urban-rural divide. And they found that in the rural areas, cervical cancer is more. In the urban areas, breast cancer is more. But when we look at the population distribution, surprisingly, 50% of women actually are in the rural area and 50% are in the urban area. So how are we going to interpret these results? The Hindu in 2013 carried a beautiful article which said the number of people coming in with early stages of cervical cancer has gone up substantially. And this is a very welcome report. So it was like from 84 to 88, 4.9%, increased to 11.7%. Many may not think this is a very impressive figure, but certainly it is. Again, an age-related study which was conducted reported in September 2014. Adults belonging to the 50 to 74 age group carry the greatest burden of cancer due to the high incidence of breast and gynecological cancers, in brackets cervical cancers among women. And evaluation, this was a paper actually published by Janani Selvaraj, a very, very interesting article to read. So time and again we have said, is it possible in India or on a large scale to carry out a screening program? Yes, definitely it is possible. But we have to make a start somewhere. As I said, every little statistic or every little figure we get, we need to report it to the tumor registry. Only then can it be projected towards the country at large. Now, in the urban areas, there's a great reluctance. I don't know why this is, because when we carry out camps or in the rural areas, it's immediately reported. But in the urban areas, little pockets where screening is done, there's absolutely no reporting to the tumor registry. And this is something where, as gynecologists at large, we should start doing something about this. I'd like to end by drawing a parallel with the maternal mortality. Healthy motherhood, still a dream for millions of women in the world, can be made a reality. The know-how is already available. We know the way. What the world needs is the will and the wallet to make it happen. Now, this is what Professor Fatala said about maternal mortality. You can just delete the words maternal mortality and put in cervical cancer. I'm sure it will be as much appropriate for cervical cancer. I'd like to end by saying women are not dying because of diseases we cannot treat. They are dying only because societies have not yet made the decision that their lives are worth saving. So this is a very, very famous quote of mine. It's from Muhammad Fathallah, past president of FIGO. And this can really be applied to almost any disease. But we, I feel, should apply this to cervical cancer, early detection of cervical cancer, and that should be our aim. So the key words are early detection, prevention where possible, using the HPV vaccine, and definitely screening whether we have given HPV vaccine or not. So that should be the way forward. And here again, we have these women probably returning home from work. Which one of them will develop cervical cancer? So I've shared my experience in a purely corporate setup with you, but definitely I'm not turning a blind eye to what is happening outside. And I'm sure we in a big way can help what is happening in the rural areas. Thank you very much.